had any hearing loss recently?
No, I haven't.
Any drainage?
None.
No. Okay. I'm going to go ahead and grab this light. We're going to take a look in your ears. Okay. Let me know if there's any pain or tenderness. Okay. What I'm doing now is I am looking and I can visualize the tympanic membrane. It's a pearly gray color. And I do see a reflection of the light. There's a little bit of cerumen in here, but that is normal. Okay. I'm going to go ahead and check the other side. Okay, once again, I can see the tympanic membrane. It's a pearly gray color. And I do see a reflection of the light. And also there's a little bit of cerumen in here as well. Okay. Now, while we're assessing your ears, we're going to go ahead and we're also going to test the acoustic nerve. Okay. We're going to do this by, I'm going to stand behind you, and I just want you to repeat what I say to you, okay?
Okay.
135.
135.
246.
246.
Okay, good. Now, another test that I can do to test the acoustic nerve is I can get a vibrating tuning fork. Okay, and what that does is that that would test to see if you can hear the vibrations in both ears bilaterally, and that test to see the air and bone conduction. Okay.
Can you do that?
No, not for the sake of this video. We won't.
Okay.
Okay. So moving on to the nose. I'm looking at your nose. It's midline. Do you have any allergies?
None.
No. Any troubles with a draining nose?
No.
No. Okay. I'm going to go ahead and palpate your nose. Any pain or tenderness?
None.
Okay, I don't feel any abnormalities. Okay, what I want you to do is I want you to take your finger, plug one nose, and breathe in, and breathe out, and then do it with the other. Does one seem clearer than the other?
No.
No,
They're both
okay.
the same.
Okay, what I'm looking for here is if there's any obstruction or if your septum is deviated. Okay, what I'm going to do now is I'm actually going to test your olfactory nerve, which is your smelling nerve. Okay, so what I'm going to do is I'm going to put something underneath your nose. It's a scent, okay? And as soon as you smell it, tell me what it is. Okay, go ahead and close your eyes.
It smells like alcohol or something.
Yep, it's an alcohol swab. Okay, so you passed that test. The next thing we're going to do, I'm actually going to take a look inside, okay? Make sure everything is normal in there. Okay, go ahead and tilt your head back a little bit. Let me know if this is uncomfortable. Okay, looking in, I do see that his septum is midline, no sores, no lesions, nothing abnormal. Okay, everything looks good on that part.
Let's see. Do you and your husband exercise during the week?
We have some access to some like recreational places to do activities at, so we have access to that.
Okay. And on a given week, how often would you say you drink or even smoke?
I don't use any alcohol or drugs or tobacco or anything like that.
Okay. Does your family have any medical history of any chronic disease?
No.
Okay. And do you ever use recreational drugs?
Mm-mm.
No. All right. Is there anything else you'd like me to be aware of before?
No, that's it.
Okay.
Okay.
Walk over that way. And then turn around and walk back on your toes. Heels. And then turn around again and walk with one heel directly in front of the other toe without looking. All right, that's good. All right, and that is our assessment for head to toe. So if at the end, we're going to ask you, did you forget anything? And you'll have a chance to say, oh, I forgot to do this. And then you can go back and do it. And if you self-correct, then you won't lose any points.